The Legorreta Center for Clinical Transplant Tolerance is a multidisciplinary, collaborative clinical center comprised of individuals from both the organ transplant and the bone marrow transplant programs.
This is the first center in the world for inducing transplant tolerance. And our mission is make transplant tolerance as a standard of care in organ transplantation.
MGH has had the advantage over 25 plus years where we've been doing research that is focused on transplantation tolerance. Our immune system recognizes a transplanted organ as a non-self or as a foreign organ. It belongs to someone else, and our body's ability to recognize what doesn't belong to us and then fight it, this is our immune system.
Unfortunately, these immune suppressive drugs weaken the immune system significantly and make patients more prone for infections and cancer. These medications are known to increase the risk of diabetes, cardiovascular disease, hypertension, as well as the risk of kidney failure.
Transplant tolerance refers to the acceptance of an organ transplant without the need for immunosuppressive medications or anti-rejection drugs.
Transplant tolerance is introduced to the body by introducing the donor's bone marrow cells, where we teach the immune system that the donor is also self to the body.
The benefit of tolerance induction and the avoidance of long-term anti-rejection drugs is that patients can lead a very normal life free of medications that are associated with serious and often life-threatening side effects.
Kidney transplant is the most common type of transplant performed, and our goal is to expand to other solid organ transplants.
We are envisioning two types of tolerance protocols, one where there is simultaneous administration of the kidney and the bone marrow, and the other a delayed tolerance approach, where the organ is transplanted first, followed months or years later by the bone marrow component of the transplant. And that latter approach would allow for deceased donor transplantation, and that would consequently open the spectrum of organ transplants to organs other than just living-related donor kidney transplants.
We're currently working on a liver transplant and getting encouraging results. If we expand this protocol, not only for kidney transplant, but expand protocol to other organ transplant, its impact of this approach is very enormous.